Hello everyone. Today we will be discussing on the topic pulp polyp. So what all will be cover about pulp polyp is the definition of pulp polyp, condition under which it forms, the symptoms, the diagnosis, differential diagnosis, histopathology, treatment, and prognosis of pulp polyp. So what a pulp polyp is? It is a productive pulpal inflammation due to an extensive carious exposure of young pulp. The other names for pulp polyp include chronic hyperplastic pulpitis and pulpal hyperplasia. The condition which favors the formation of pulp polyp is that there must be a carious lesion, the cavity must be very large, and the irritation that causes caries should be of a very mild irritation. The chronic low grade irritation must be there, and the pulp must be young and resilient. This is why it is most commonly occurs in children and young adults, because their pulp will be more young and resilient, and it will have more property of resisting the infection. So these conditions favors the formation of pulp polyp. Symptoms of pulp polyp. Pulp polyp is usually asymptomatic. There will be no pain or anything else, but there may be a difficulty while mastication and chewing. Diagnosis. The diagnosis of pulp polyp is mostly made clinically. Radiographically, it shows large open cavity with direct access to pulp. Clinically, it appears as a fleshy tissue. It's polypoid and fleshy and polypoid, most commonly seen in children and young adults. The major problem with the diagnosis is that you will have confusion to differentiate from gingival proliferation and a pulp polyp. To come to a conclusion whether this is a gingival overgrowth or pulp polyp, we have to raise and trace back the stalk of the tissue back to the origin of pulp chamber. If it origins from the pulp chamber, then it is a pulp polyp, and if it origins from the gingiva, then it is a gingival overgrowth. The pulp polyp is not sensitive, as sensitive as a pulp, but more sensitive than gingiva. Cutting the pulp polyp doesn't cause any pain at all, but if you apply pressure, it may cause mild pain because the signals will be transmitted to the apical part of the pulp, which is still has some ability to sense pain and all. The differential diagnosis. The appearance of the pulp polyp is very characteristic. It can be easily recognizable clinically. The only thing is that we must be able to differentiate the pulp polyp from proliferating gingival tissue. Speaking about the histopathology of the pulp polyp is composed of granulation tissue. This pulp polyp may or may not be covered by stratified squamous epithelium. The source of this epithelium comes from desquamated epithelium from oral mucosa or tongue, or epithelium of the gingiva. The pulp in the pulp polyp is irreversibly inflamed. Treatment options for pulp polyp is you have to first cut it out with a periodontal curette or spoon excavator. There will be bleeding, because being a granulation tissue, there will be a lot of bleeding. It can be stopped by applying pressure, and it must be followed by root canal treatment. The prognosis in the case of pulp polyp is prognosis of the pulp is unfavorable. As we said, we will take it out while doing an root canal treatment. We completely remove the pulp. The prognosis of tooth is favorable after root canal treatment and adequate restoration. If proper root canal treatment and the correct restoration is done, that we can save the tooth for a longer period of time. Thank you.